Lovely. Welcome, everyone. We are so glad to see you join us. We have the team here and various members of the Nursing Now Challenge who are actually coming from all corners of the globe. And we're going to hopefully have an exciting hour with you, share with you lots of information about the Nursing Now Challenge and the experiences that we have as being part of that family, that global network. And you're going to hear from the people who are actually living this dream, the wonderful Amy, Rhoda and Zipporah. And I will let them introduce themselves to you. But first of all, my name is Aisha Holloway. I am the Programme Director for the Nursing Now Challenge, a huge privilege and honour to do that. It's one of the best things in my life and one of the best things that I do because I work with amazing, inspiring people, largely early career nurses, but also established career nurses who are similarly committed to lifting early career nurses up, providing them with lots of opportunities and ensuring that they have a position and a place in and a voice in the future of our profession. So we're going to start off with a little introduction by everyone. So I'm going to just ask Amy if you would like to say who you are, where you are, Amy, and then I'll get our other colleagues to do the same. Thank you so much.
Of course. Thank you so much. I'm so excited to be here with you all today. My name is Amy Staley. I currently work as a clinical nurse manager in New York City at New York Presbyterian Hospital, Weill Cornell Medicine. And I also serve as co-chair of the Nursing Now Challengers Committee alongside Catherine Clarissa.
Lovely. Thank you so much, Amy. And then we go to Zipporah.
Hi everyone, Zipporah Iregi. I'm a registered nurse based in Kenya, and I also work as an advocate with the Africa CDC. And in the Nursing Now, I'm part of the Challenges Committee. So it's great to be here. Thank you.
Oh, wonderful, Zippy. Thank you so much. And then last but not least, Rhoda.
Hello, hello everyone. I am Rhoda Redulla, and I'm also here in New York City and with Amy, and I work at New York Presbyterian, and I am the director of Nursing Excellence and Magnet Recognition with oversight of our system magnet program with our 11 hospitals here at New York Presbyterian, and really excited to be here. I have been part of Nursing Now, involved with Nursing Now since its inception, and I'm really excited to share with you our journey today. Thanks.
Oh, thank you so much. And for all of you who are joining us, I know we have just a couple of ways to engage while we're together in this hour. So if you have got any questions, the best place to put those is in the Q&A chat, and we'll pick those up at the end. But we would love to hear from you. Tell us who you are, where you are, and you can put that in the chat. And I can see already we've got lots of people, some names that I already know, and it's so exciting when we start seeing people from all over the world. We've got Rio de Janeiro on Brazil, so I'm going to have to start sharpening up on my languages so that I can say hello to everybody. But I'm so glad you've joined us, and let's try and get this show on the road and get you either joined or find out more about this. If you're already a member, then you can share the most up-to-date information about what we are doing and what lies ahead for 2024. So we've got Saudi Arabia as well. It's wonderful. I get very distracted by all these things popping up, but I know that Hannah, our wonderful colleague behind the scenes there, is ready to put my slides up, and we're ready to go. Oh, Andres, yes, haha. Hi. Oh, we've got somebody from the UK. Wonderful. I'm in Scotland, Edinburgh. It's very rainy and very dreich, as they would say here. So let's go. So my presentation today here, I've got 12 slides, and I want to really give you an overview of what the Nursing Now is about, the Nursing Now Challenge is about, and also give you some examples of the programs and initiatives that we're involved with this year that you can also be involved with as a member, and also some of the newer things we've got planned for the year ahead. But the most exciting thing I can't actually tell you about just yet, but in the coming weeks, there will be some exciting, very exciting news about opportunities available to you all. And it's pretty wow. So watch this space. And if you've not joined, you better join soon. Okay, so the Nursing Now Challenge is this global network of early career nurses across the globe. And the Nursing Now Challenge historically was part of Nursing Now campaign. It was known at the time as the Nightingale Challenge. Its focus was also on leadership. And when we transitioned over at the end of the Nursing Now campaign, the Nightingale Challenge became the Nursing Now Challenge. And it's a programme of the Burdett Trust for Nursing who fund it. We are split across 6 of the regions aligned to the WHO regions, so we map onto those. And the network, when it was the Nightingale Challenge, was sitting at about 30,000, and it is now at 61,000. And that really is largely to the work, the great work that my predecessor did with the team, Hannah and Andrea, to get us up to nearly 62,000. But we want more. It's not enough. If we are going to change the face of nursing, if we are going to influence, then we need bigger numbers, because creating a critical mass and a social movement, as we saw with Nursing Now, was the thing that raised the profile, amplified the voice, and accelerated change for us. And we want to see more of that moving forward. So you will see our network is made up of hospitals, universities, and health organisations. Our split probably at the minute is students are about a third of our 62,000, and the other 3/4 are hospitals and health employers. And you will see our largest numbers are sitting in Southeast Asia. Eastern Mediterranean are our smaller numbers, but myself and Shirley Baines, the Chief Exec, have recently just been out to the Emro region in Saudi Arabia, telling them and sharing them all the news about the wonderful work we are doing. So we are hoping to see a significant uplift in that. But hopefully with your voices and your knowledge of what you'll learn today, you will be able to go out there and share the exciting opportunities that lie within the challenge. Next slide, please. Thank you, Hannah. So what are the key areas that we are working on? We want to, here's the thing. What we understand is that when we give you permission, when we enable you, when we provide you with opportunities, you are able to take them. We are not here to tell you what to do. We are here to support you in doing what you need to do. And that's hopefully what we will provide you in this package across these 4 pillars. So one is resources. Resources of knowledge, of information, of minds, of expertise. That comes from across the globe. You don't have to access that resource just in your own country. We are able to connect you with colleagues in America, in Africa, in Brazil, in Saudi Arabia. That global cohesion and network is what's needed. And we have many resources for you. So if you're ever in any need of anything, you can contact us. We will put you in touch with the right people. We will direct you. We will signpost you to who will be a great resource for you, whether that be a mentor, a network, another organization, other young nurses, other businesses, other advocates. We have access to those and we can share those with you. The second bit that really feeds into that is the networking, particularly strategic networking. Operational networking is what you do every day in your everyday job, but we want to elevate you into that strategic networking. And that's not just about what you bring to the network, but what the network can bring to you. You can be a broker, you can connect people. And that's what we want. Generosity of your time and of your, vision and values is such a great commodity to have, and it doesn't cost anything. So we want to network you, because once you are networked, your work will have a ripple effect. You will be able to have a wider reach. And that network can bring so many things that will nourish you as an early career nurse. And we know that, and midwife for that matter. So the networking not only brings you together as the social movement, but for you personally and individually, it will bring great benefits. The third bit is your leadership. You lead yourselves every day. Okay, and again, we want to support you, want to galvanize you, want to help you develop yourself personally and professionally. And we do offer some formal training. We have the health action training, and I think Zippy has done that. And there's a great video of her talking about what that meant for her and how transformational it was. And that's about how you take this thing, your machine, and take it out there with your purpose, with your ability to influence, with your voice. So we have that in a more formal format, which is around a certificate, or there's a more generic opportunity to do that. But also there are many other opportunities for you to develop your leadership, and you'll find out a bit more about what is available in the following slides. And the final one is research and innovation. We listen to our 61,000 family. And what was really strong coming back to us was we want to understand how we can develop the evidence, create the evidence for research, for influence, using that data to create dialogue and inform decision making. So increasing research capacity and innovation was one of the key things. And we have actually listened to that and responded with our 1,000 challenge, which I will tell you a little bit about. But we know that having early career nurses increase their research capacity means that we can accelerate global health solutions, because you are at the front line, you know what is going on and what the needs are of your patients and your communities. So this is one of the other things that we will offer you. Next slide. So where do you fit in? If you're thinking, okay, Nursing Now Challenge, okay, I'm going to join, what does that look like? So you will be joined in relation to your geographical hub. So wherever you're located, you will go into whichever hub links to your region. And within there, you will see we have the hub leads, regional hub leads. And each region has a regional hub lead, and there's 4 of them, and they will be your contact point. Similarly, our advisory board, we have a number of key nurse leaders on the advisory board, as well as Amy and Clarissa, and they are also linked to a region. And what we're trying to do is really engage our advisory board members more directly with our regional hubs, because I think they offer inspiration to you and are a source of being able to leverage and open some more doors for you. So we're going to do that, but you would sit in one of these regional hubs. That's not to say that you will stay there in a silo. Our regional hubs actually work together and they network together. But what we know is that even in one region, there are huge differences between countries and different challenges that are faced by others in other regions. So whilst you're in your regional hub and you'll have that identity, the great thing is that you will be able to collaborate and network with the other regional leads and hubs and people in them. Next slide, please. And I just want to big shout out to the regional hub leads, because they are very, very good, and they are the reason that the regional hubs work. The work they put in is phenomenal, and they have a passion, they have a vision, and we are eternally grateful to you. So a little thank you, or a big thank you. Now, when we're thinking about what can I get involved in, I'm interested in influencing. I want to, I see a problem in my community. How can I do something about it? Now, what we do is give you opportunities to test that out. So we have recently joined this global collaboration, the Global HPV Consortium. Human papillomavirus is a significant issue globally, yet there is a vaccine. Now, we are partnering as one of the only workforce organisations, and we will be part of the advocacy movement on this. So wherever we can encourage our members to be involved, they can get involved with this. So we have a colleague in Nigeria who is a nurse. She has gone back to Nigeria and after studying, and she's actually doing a research study that she's come up with herself and linking into this initiative globally. So we are a consortium partner. The launch was in Kuala Lumpur last year, and the new action plan for the next 3 years has just been launched and published. And there's some great opportunities for you to be involved in this. So if you're trying to understand, well, how does advocacy work? How does influencing policy work? How can I get involved with this? then speak to us and we will connect you and link you with it. It's a wonderful organisation. We've done a lot of work with Sabin in the past year to 2 years around our vaccine ambassadors, and it's been part of our Global Solutions Initiative also. And the work that has been done there is absolutely phenomenal. So an example of how you can get involved in really large global networks and organisations and expand your mind and expand your scope, because that's what we want to do. We want to build you better and give you the skills and the experience to move forward. Next slide, please. Okay, now this takes us back to the health action training that I talked about, which is the leadership development. And hopefully we'll hear this little video, if possible. I can't hear it. I think Hannah is just trying to get some volume on there. If we can't, what we can do is
provide specialised communications training for nurses and midwives. We draw on applied drama, actor training, and person-centred practice to help you communicate effectively, manage stressful situations, lead on solving problems, and learn from perceived failures. We're pleased to partner with the Nursing Now Challenge to bring our unique training to members of this global network, supporting nurses and midwives around the world. Our bespoke courses are accredited by the Royal College of Nursing, the CPD Standards Offices, and the Nursing and Midwifery Board of Ireland. Over 95% of our participants strongly agree that our courses provide a positive learning experience. For many, it's game-changing. And thanks to the support of the Burdett Trust for Nursing, it's completely free of charge.
My learning journey began with health action training, and arriving at my third course with them, I feel more positive. At personal level, I'm more resilient.
The experience in itself was something extraordinary. It was just amazing, and I feel like I'm a better person for it.
To learn more about our approach and register for an upcoming course, visit the Nursing Now Challenge website.
Wonderful. Thank you so much, Hannah. And I think actually hearing it from those who have taken part is very powerful. The transformation, the experience that's happened personally, and a wonderful opportunity for you to be involved and gain that insight into how you can lead yourself. And that requires a lot of self-care. And we really can't emphasize that enough. If you are out there doing the work that you're doing, the emotional labor of that is very high. And what we need to do is ensure that we are able to care for others. And before we can do that, we have to care for ourselves. And that's part of the joy of Nursing Now Challenge, because it's a space that has been created for you to be the very best that you can be. Without fear, without criticism, without worry. You are surrounded by people who want to support you. And the heart training is just one of the most wonderful ways of doing that, and really helping you flourish and be the best person that you can be and the best nurse that you can be. Next slide. So this takes us to the research element, the Global Health Network. And this was a collaboration, or is a collaboration, with the Global Health Network, which is based at Oxford University, run by Professor Trudy Lang. And we came together because we both have this, I guess, wish to increase research capacity. And our early career nurses, in fact, the Challengers Committee are doing it right now. They have developed a proposal, they're looking for funding, and they have this great research idea, and they're going to do it. And it's absolutely fantastic. So thank you, Clinton, that's great. The health action training, it helped me greatly in my career, wonderful. So the 1,000 challenges are challenge really to ensure that 1,000 nurses and midwives and health workers have the opportunity to identify an issue clinically in their area or within their community that's health related that they want to ask a research question about. Now, you can be quite experienced or not. You can register on the platform, and then you will be networked into some mentors and supporters who will help you achieve this. who will help you develop your research idea into a question. And if you haven't had that educational experience, the resources are there. How do you develop a research question? The resources there, so you can undertake that learning and then move on to the next step. So at each step of the way, you will be supported, guided, and encouraged. And by the end of it, you will have undertaken your own research project. You will be able to hopefully write a paper on it. And the most important thing is change practice and inform practice. And that's what we're doing. So if you're interested in that, have a look at the Nursing Now Challenge website and get yourself registered. My brother, good to see you, hear from you. Okay, now the Global Solutions Initiative. I actually think this was Hannah's brainchild. She's not on our screen today, but she's going to be soon, I think. This is a wonderful initiative, and we've had several of these over the lifetime of the Nursing Now Challenge. And the idea for the next one, and this is an idea, we can be flexible, we can listen to other ideas, is around disinformation and information. We saw a lot of this during COVID, and we see it now. You know, social media is there, there's information and disinformation out there, and it's causing us huge challenges. So we're hoping to work with our colleague, Alexandra at WHO. She's doing amazing work with other people globally. And she's helping us to try and formulate our ideas around this Global Solutions Initiative. So this is a wonderful way of engaging with a topic that you want to interrogate a bit more, consider, discuss, and probably do something with even in your own area. So that's probably our next Global Solutions Initiative will be in this area, but we're looking for other examples, other things that you might want to focus on. So please get in touch. It's not just one-way traffic. It's about us thinking about what is it you need and what can we do to help you. Next slide. Now, we used to have, we still do webinars, but we're renaming them as debates because webinars, that sends a signal that I'm just going to sit here and listen and you're going to talk to me and then I might do some other stuff while I'm listening to you. Actually, what we want is we want to engage you in the discussion. So we're going to make those a little bit more interactive. They always have been, but I think it's just the title. We want to frame it in a way that says, okay, debate, that's what we want to get involved with. We don't want to be passive learners or passive participants. We want to be engaged. We want to be vocal. We want to try out how we frame things. Because remember, when we've got our 30-second elevator pitch, when we've got the Minister of Health for our country in front of us, or even the Prime Minister, which some of us did in Geneva, and Zippy was there, when you've got them there, what do you say? And only by practicing, it's like a muscle, practicing these things, thinking about it, can you pick up tips? Can you think about phrases that you might use? Can you articulate what it is that your ask is? So we're creating the debates, and we've had to think about what we're going to do with these in this coming year. So a big thing that we hear from early career nurses, and even myself, is our identity and imposter syndrome. I still have that. And I've been in this a long time, this business. But it's still there, that little thing on my shoulder telling me, are you good enough? Do you know everything you need to know? So we're going to talk about how you manage the identity. And we've spoken to Peter Singer, who was, up until very recently, the Director General of WHO's, one of his special advisors. And he's written a lot about this. So he's going to come and do one of our debates. And we'll look at other things, you know, the positive way about staying healthy within this profession. We see burnout globally. We see the challenges of being nurses and midwives. How do we protect ourselves? How do we support ourselves? And then we're moving on to advocacy, because that's really where the action happens, isn't it? We can talk the talk, but we need to walk the walk and actually do this. So let's think about how we engage you with advocacy, how we engage with grassroots lobbying, and how we can identify some topic areas. So one of them was a suggestion of climate change and planetary health, but there are many things, safety at work, you know, safety of our colleagues. Look at, I mean, we are in a conflict rage across the world. Nurses, healthcare workers are being targeted. This is unacceptable. So let's have a say, let's have a voice in this, and let's speak up for our profession. So these are the kind of things we want to talk about. And then the third one is thinking outside of nursing. Now, Nigel Crisp, who started nursing now, he was a great believer that we were in an echo chamber often, and we needed to think outside of that box. So actually, what we want to do is engage with other disciplines: economics, genomics, finance, AI, informatics. NCDs we're a bit more familiar with, but these other areas are really important for us as nurses to have a voice in. And why not? Because all of these elements are related to healthcare, health for all, universal health coverage, sustainable development goals. Nursing is at the very heart of those. So let's have a debate about those and think about why nurses need to be in that debate, why we need to be having a voice around it, and why we might even do some research on it. Who knows? You might well be the next Prime Minister of your country. And finally, or penultimately, are we on another slide? Yes. Okay, so some of you perhaps on Monday night saw the second part of this. And this is our Global Book Club. And really it's a chance to look at what's coming out now publication-wise in terms of books that are nursing related. So this was our very first one, and Sarah Di Gregorio is the most wonderful person, not a nurse, but has been able to articulate what nursing is, what it means to us, and the power we have to change the world because of who we are as nurses. And there have been 2 sessions, 2 recordings. The second one was on Monday evening. So Sarah was based in New York, Professor Jill White, she sits on our board, Emeritus Professor from Sydney, Australia. They had an armchair discussion and critique of nursing and the book, and it was absolutely wonderful. Please have a look at those. They're on our YouTube channel, and you can link to those from the Nursing Now Challenge. But they're wonderful for those of you who really would like to engage with these books, perhaps don't have time or topics, but want to sit and listen and ask questions. And really, it was a very emotional experience listening to our origins, why we find it challenging now as nurses to have a position of power, how we have struggled, but how we can overcome it, and how we must do that together. So hugely, hugely important book this was, and it was a great experience. Now, what we think, you might want to set up your own book clubs in your own countries. That would be great. Do that. And our big news is our next session will be in May with Catherine Trebeck, who is a health economist, and she focused on the well-being economy. Now, that's the kind of economy I want to be living in, where there is social justice, where there's health for all, where there's equity. It does not matter who you are, where you're from, your race, your colour, your gender. You have equal access to a full and fulfilling life, and that includes health. So the health economy is one of the things we're going to be talking about, and the people interviewing Catherine are going to be some of our early career nurses, so it could be you. How about that? That is what we have in store for May. We're just getting that set up now. If you have any other ideas about it, what we want to do is broaden your horizon of things that are related to nursing outside of our clinical areas, because they all matter and they're all interrelated. The intersectionality of it all is very clear, and we want you to be exposed to that. We're offering you this choice. And I think the final slide is probably just our contact details. Yes, so I'm going to stop talking now. Thank you for listening. If you've got any questions, put them in the Q&A. This is our social media, and what we know from the Nursing Now campaign, social media was one of the main ways we created an impact and were able to build a social movement. So we need all of you on social media, tweeting, retweeting, whatever else it is you young people do. We need you to do that. DMing, yes, I did DM somebody the other day. Wasn't sure what it was, but it worked. So we want more of that, please. Now I'm going to hand over to the wonderful Amy Staley, and she's going to talk to you about the Challengers Committee, her experiences of that, and she will be hugely inspiring.
Oh, thank you so much, Aisha. That was a great introduction and amazing work that everyone's doing at Nursing Now. My name is Amy Staley. I am a proud registered nurse, and regardless of where you're joining from, I'm just so glad that your paths have led you here with us today. As I mentioned earlier, I currently work as a clinical nurse manager at one of the best hospitals in New York City, and I also have the privilege of serving as co-chair of the Nursing Now Challengers Committee alongside Catherine Clarissa, who's a lecturer and research fellow. Also, happy Valentine's Day to anybody who's celebrating today. About 12 days ago in the United States, on February 2nd, 2024, we celebrated Groundhog Day. So Groundhog Day is an ancient celebration where a groundhog pops out of the ground to predict whether there'll be 6 more weeks of winter or an early spring. And on this same day, I celebrated 5 years holding the proud and privileged title of registered nurse. And I had always found it ironic that my licensing anniversary had fallen on such like an uncertain and unpredictable and almost silly holiday. Because if you had asked me to predict that an early career nurse with just 5 years of experience would now be connected to over 60,000 exemplary and esteemed nurses across 91 countries while managing one of the most prestigious orthopedic vascular units in the nation, I would have never believed that that nurse would be me. I was privileged to have serendipitously found a wonderful mentor, Dr. Rhoda Redulla, who you'll be hearing from next, who really just saw this future version of me before I could imagine or dream it myself. And after speaking at the Nursing Now Global Footprints event in 2021, I was invited to join this newly formed Nursing Now Challengers Committee. So this is a committee, a group of early career nurses founded by Nursing Now who work to recruit, retain, empower, and grow the nursing profession. So the Challengers Committee is broken down into the 6 regional hubs that Aisha had mentioned: the Americas, Europe, Southeast Asia, Western Pacific, Eastern Mediterranean, and Africa. And each hub is chaired by 4 members of the committee who lead projects and initiatives to impact the patients, communities, and really the entire nations that they serve. The global nurses and midwives who join as members of the committee are provided with this amazing opportunity to identify innovative and creative ways to support nurses and midwives in their roles, not only as practitioners, but also as leaders, advocates, change agents. I mean, you name it. As a member of the committee, nurses and midwives are placed in this unique position to impact real change, increase recruitment, influence retention on a global scale, and still demonstrate the rewarding, gratifying, powerful positions that nurses in this profession hold. So these leadership and development opportunities have strengthened and shaped communities in rural areas of Malawi to the coasts of Australia. Some recent projects and initiatives of the committee include global research studies, joining together to connect with our incredible authors from our book club, taking part in the health action training that you just saw, which is a specialty workshop to boost person-centered communication in both health and social care. Several members of the Challengers Committee have gained support to apply to many of our Nursing Now challenges that arise throughout the calendar year. Some of those include the Immunization Advocacy Challenge, which included an incredible storytelling training with People Power Health, connections to global stakeholders during Universal Health Coverage Day, and invitations to participate and attend global health events all over the world. Many of our members have also flourished into new roles professionally since joining as the Challengers Committee. Broken down by region, I'll share a few individuals who you too could have the opportunity to connect with. So from the Americas region, we have Amy Horcasitas, who joined as a new graduate nurse in Mexico and now serves globally as a United Nations youth representative for Sigma. In Europe, we have master's student in research, Andres de Juan, who is also in the chat with us today. From Barcelona, he discovers new methods to healing, curing, mending, and breaking down barriers through the hope of science. I could write an entire book about Ernest Lamuel from Southeast Asia, and it still would not be enough to describe the impact that he has on the mental health field in India as a psychiatric nurse educator. Hazel Veritan from the Western Pacific region who also works to heal both the minds and hearts in the mental health world. Sana Gul of the Eastern Mediterranean region is a nurse from Pakistan whose voice and identity have shaken and impacted the entire world from her presence at the World Health Organization's pre-World Health Assembly. And of course, in Africa, we have Niba Clinton and Mohammed Madber, who are also joining us in the chat today. They have influenced vaccination efforts all over the world. And of course, we have one of the most powerful nurses in the African region, Zipporah Iregi, whose advocacy efforts in Kenya with the African Union and IntraHealth have impacted the past, present, and future of nursing care. Through my connections with these individuals and the incredible Nursing Now Challenge Board of global health experts, my voice has also traveled from the bedside to the United Nations General Assembly, Harvard University, the World Health Organization, and to countries and rooms that I have yet to even enter yet myself. If you had told me these stories 5 years ago, I would have told you that they were crazy, unrealistic, and unattainable. But today I can state to you with confidence that these stories are not crazy, unreachable, or distant. They are the stories of an average day in the member of a Nursing Now Challengers Committee. If you're interested in joining the Challengers Committee, we would love to have you. You can please send your resume and cover letter over to info@nursingnow.global. While I and Zipporah and the others here today cannot predict or forecast where this committee will drive you, I can assure you that the members of this committee and the board will support, mentor, empower, and await the future version of you, even if you have yet to dream it yourself. The future of nursing awaits, and I can definitely see it here in the chat today. So thank you guys so much for joining us. And I'll pass it over to my amazing mentor, colleague, and human and friend, Miss Rhoda Redulla, who needs no introduction.
Thank you so much, Amy. It's an absolute joy to hear you and just see you grow and flourish, not only in your role here at Nursing Now, but really as a leader in all these global initiatives that you already mentioned, and Aisha. So I have introduced myself, but I'll share with you again. I am Rhoda Redulla, and I'm the Director of Nursing Excellence and Magnet Recognition for the New York Presbyterian. The first time I heard about Nursing Now was at the World Health Organization Public Health England Conference in 2019 in Liverpool, England, where a dear friend who is now the chief exec of Foundation of Nursing Studies invited me to. And I know Professor Aisha Holloway is grinning right now because nursing really is such a small world, right? But what are the chances that when I heard about Nursing Now at that conference and coming back to New York, that same week, I came back to our initial designation call with Magnet. And if you hear Amy's story, that was her first day as well working at New York Presbyterian. And that to me now, and reflecting on that, brings that full circle story of our journey in Nursing Now, but definitely not over yet. That we're just sharing you this inspiring journey that we've had with Nursing Now and beyond. So I will share with you a few slides, and let's see here. Yes. So this is our health system at New York Presbyterian. We have 11 hospitals here in New York City, and I sit at our Institute of Nursing Excellence and Innovation, which is our corporate nursing department. And you can see here our different offices and functions. First is our nursing research and evidence-based practice program. We also have our nursing continuing professional development program, and nursing professional development and nurse residency program. And where I am directly a part of is nursing excellence and magnet recognition. We also have our professional nursing practice and patient education department, nursing academic partnerships, being an academic medical center. This is a huge part of our health system. And we also have our nursing quality and patient safety department. And these last two, nursing operations and nursing finance and nursing informatics. Together, we develop and support programs that are integral to the advancement of nursing practice across the NYP health system, providing oversight and support to all these functions. And I mentioned to you that we are an academic medical center, and I really am highlighting this slide because it is directly aligned to our mission in Nursing Now. New York Presbyterian is proud to have academic partnerships with more than 40 schools, believe it or not, across the United States to provide 3,000 to 4,000 nursing student placements across the health system, across our 11 hospitals. And this is all levels, right? Not only our Bachelor's of Science in Nursing students, but including master's students and doctoral students, ensuring that we provide students the support that they need and the mentorship that they need to be able to succeed. So now here, this is one that's really near and dear to my heart. And if you have not heard about the Magnet Recognition Program, well, this is an introduction to you now. Magnet Recognition Program is a credentialing program that is delivered through the American Nurses Credentialing Center. It is the gold standard of nursing excellence, and only about 9 to 10% of hospitals across the United States and several internationally designated organizations across the globe are magnet designated. It's the highest level of recognition for nursing excellence. And if you see this diagram here on the right, you will see the domains of magnet. And I want you to just look at transformational leadership, the red oval here, and also structural empowerment here on the green oval. And why I share that is that Nursing Now, the Nursing Now mission is directly aligned to these domains. Under transformational leadership is mentoring and succession planning, which really is, which are two areas that Aisha had highlighted earlier, right? Leadership development, which is at the core of the mission of Nursing Now. It is directly aligned to what we are also working on and aspiring for as magnet organizations. Structural empowerment, keyword there is empower, right? Empowerment. And in a nutshell, that is supporting the professional development of nurses and more. And I can speak about all the different programs that we have that align to these domains. Now, when I think of Nursing Now, I can highlight these programs that we have, not limited to this list, but just highlighting some of the programs that we have developed that are aligned to our involvement with Nursing Now. We have our Quality Improvement Academy Fellows, which is a beautiful collaboration of physicians and nurses working on a quality improvement or performance improvement project together, which is also a mentored program. We also have a Chief Nurse Fellows program where our new or early career nurses have the opportunity to work on innovation projects, or again, QI projects, where they receive mentorship from a nursing leader. And we also have academic practice partnership fellows who are our research fellows, and they receive mentorship from a PhD prepared faculty from one of our partner universities in the area. And of course, we have our nurse residency programs, which I will highlight on the next slide. And this is our nurse residency program, where we are part of the nationally acclaimed Vizient nurse residency program. And the main aim is to bridge the gap between academia and practice. If you think about that, that is so important, right? Coming out of nursing school, how do we fill those gaps and bridge that gap to ensure that our new nurses are able to function to the best that they can in the clinical area, and also emerge as leaders in quality and in their professional roles. So this is a formal, structured program, and really proud to highlight that our own Amy here, Amy Staley, is a proud grad and alumni of this prestigious program, and several other nurses who are directly involved in the Nursing Now Challenge. I can tell you a lot about our journey as an organization, but one of the highlights of our involvement with Nursing Now was last year, where we were a host and a partner to the Nursing Now Challenge Global Solutions Initiative. I know, Aisha, you mentioned just in your intro that I think this is the brainchild of our own Hannah Finch here at Nursing Now. So the theme for this specific Global Solutions Initiative was nurse retention and well-being, which is very much aligned to what we are all working on as a global nursing community, a global healthcare community. And we had a lot of participants who submitted their entries to this challenge, and the winners, you can see them here during one of our mentoring sessions, along with our one of our magnet program directors here at New York Presbyterian. It's Cosme Taipei, who's on the screen, and we have our colleagues from the National University of Columbia joining us in this mentoring session. And I will stop there with my slides, but really just reflecting on the wonderful journey that we've had at Nursing Now. And on a personal note, I have been involved in many webinars within the last few years here at Nursing Now. As you can see, we have great alignment with nursing excellence and magnet, with those two domains that I have shared with you. So whenever a topic or a focus comes up where our voice as a New York Presbyterian community is needed, we are there to share our journey and our expertise. And also, I know that Amy and Stephanie O'Neill, they've been part of this beautiful research work, which is evolving along with other colleagues in the Americas region. So I will stop there, and I will pause for questions after everyone has spoken. Thank you so much.
Thank you so much, Rhoda. Wonderful to hear about the wonderful work you're doing, and mentioning our connection with Jo. A nurse, it is a small world, and things come round to connect us. Thank you so much for sharing that. And because we're coming towards the end, we still have to hear, saving the best to last here, our little Zippy. You go for it, and you can hopefully share and tell us about your experience of being part of Nursing Now Challenge, Zipporah. Thank you so much.
Thank you so much, Aisha, and it's so good to see all the familiar names of the people who have joined us. My name is Zipporah Iregi. If you missed my introduction, I am a registered nurse based in Kenya, currently working with Africa CDC and IntraHealth, and it has just been an honor being part of the Nursing Now journey. So I think the first time I heard about Nursing Now was back in 2018. I should have been second year, third year of my nursing schooling. And at the point, it was at the point where I was wondering what my nursing career is going to evolve into. Because at the time our major concern was that, and it's still a concern now, is that, nurses do not hold the positions of power. Even at the basic level in the community or in the hospital, we see that the opinions of nurses are not as highly regarded as those of medical doctors or other professionals. And so I started to wonder, how can I contribute to the nursing community more? Because I am one person who does not know how to keep quiet. We need to use our voices to show the world, what nursing is and the potential there is in the nursing community to actually achieve, universal health coverage and health for all. And so through the Nursing Association in Kenya, then we got to learn about this amazing campaign that I think was launched in 2018, actually. And so my curiosity grew, to actually came to learn that nursing is so much more. I think, and you will attest to this, that our education, especially at the diploma and degree levels, focus solely, like a lot of that focuses on the clinical part. So I came to actually understand that nursing is so much more. Nurses can be in leadership, nurses can be in policy development, nurses can be researchers, nurses can be educators. And that opened my eyes to a whole world of potential journeys in my nursing career. And so I think back then it was not Nursing Now Challenge yet. It was Nursing Now campaign. And they had just launched the Nightingale Challenge, which was bringing together early career nurses to help them grow in leadership. And I got attached to mentors like Dr. Catherine Holloway, Barbara Stilwell, I still remember them. And it was such an amazing opportunity to actually be able to connect with people I have never met in person, and to learn from powerful mentors who have been laying the foundation for us as nurses to actually step on that and build on it to ensure that we are raising the profile and status of nurses. And I think that was my first mentorship one-on-one in the Nursing Now, and I'm grateful to those mentors that I connected with. But then beyond that, there was the health action training. You have seen my pretty face in the introduction video. And that is just, it is such a mind-blowing experience to see how we can merge drama and nursing to actually help nurses in their self-care and dealing with burnout, in dealing with their communication and things like those. And I was so excited that Nursing Now provided that opportunity, because where else would I have gotten such an amazing opportunity? And then last year, attending the World Health Assembly, my goodness, I am still, I don't know, I'm still on a high from that. I still haven't gotten over the fact that I was seated in a room with the leaders of health, in the world, ministers of health, and sitting with them and actually engaging in conversation. And Nursing Now, I am eternally grateful to you. And I think I have grown so much in my career because of the mentors and the friendships and the connections that I've been able to build with the Nursing Now community and Nursing Now Challenge. I've just been looking back at my life since I graduated in 2019. We started a mentorship program with a few of my colleagues. And, we were new graduates. We didn't know what we were doing, but a lot of what we learned from the Nursing Now, the skills in advocacy, how to use our voices, how to create platforms for nurses to grow, helped us then develop the Kenya Students and Novice Nurses. We started with a group of around 150 students, and now it has grown to reach over 3,000 students in Kenya from different institutions. And those who we were mentoring back then are the ones now leading that conversation. And it has just been so exciting to see that actually, nursing is growing. We are making steps to ensure that nurses are being involved and are being roped into the conversations of how to build, safer and healthier lives for everyone. And I have been nurtured with Nursing Now to use my voice in advocacy. And I think Amy mentioned this in her presentation. And I actually got exposed to working with organizations like the Africa CDC and IntraHealth because of Nursing Now. I think I spoke at so many webinars in Nursing Now during 2020, I think when COVID had begun, and I slowly started to actually realize that me, myself, as Zipporah Iregi, can use my voice, from the village in Kenya, can actually cause an impact, can actually engage in conversation. And it has just been an amazing experience, even to win the Nursing Now Challenge Award in 2022, the award for advocacy and communication. I still have that plaque put somewhere, and I look at it every day, and I cannot imagine that I've been able to grow this much. And I know for certain that if it were not for the Nursing Now Challenge, I would not have, gotten to where I am today. But, even beyond just growing in my leadership, growing in my advocacy, I've also grown in my research skills. With the global community in the Challengers Committee, we are doing this project, and it has just been amazing to hear the conversations that are going on, to actually understand what research skills are. I feel like when I did it in school, it was just to make sure that I graduate. I didn't pay a lot of attention, but I have grown to actually understand the role that research plays in informing decisions, in building policies, and why it is important for us to practice evidence-based, care, even as you go to our patients, to ensure that the results we are getting are backed up by data, and we can actually look at where we have started from to see how has our research improved or influenced change, and what then can we improve even more. And if for nothing else, Nursing Now Challenge for me has allowed me to connect with a community of like-minded individuals, a community of nurses who are passionate about not just changing nursing, but who are passionate about improving health. And that for me has just been very encouraging, to actually realize that the future is indeed brighter. There's no place to go other than higher and higher. And to see that nurses in their different spaces, Amy in New York, Andres in Barcelona, me in Kenya, others in Nigeria, the amazing work that they are doing, and actually seeing what they are achieving, actually learning from them, understanding the kind of work they're doing, trying to see how then can I apply it in my life, how then can I apply it to Kenya, how can we foster that peer-to-peer learning, how can we then come together to share these experiences, share these solutions for global learning, for global engagement, and to build on that conversation that nurses are actually boots on the ground doing this work, improving lives. And I'm sure that all of you are in this conversation, you're doing something, whether in large scale or in small scale, to improve health. And on behalf of the Nursing Now, I want to say thank you, for those steps that you're making to improve health. And I look forward to see all of you join us. There are amazing things that have already happened, but more is yet to come. And it is without a doubt that Nursing Now Challenge for me has been quite the experience, has been quite the platform for me to grow personally and also to grow in my career. And thank you so much, Aisha, for this opportunity.
Oh, wonderful, wonderful. How wonderful has this hour been? Keep listening to you all. Zippy, thank you so much. And it's just, I don't know, sometimes some days are very difficult, aren't they, as nurses? And then we have this hour of just pure joy. Listening to Amy, the amazing Amy, who is just, wow, I was never like that at this age. And Amy or Zippy, you're just so amazing. And we just need to get you out there. We need to get you out there and for people to really see what nurses are and what nurses do. So without further ado, and can I just thank everyone who's participated today, your encouragement, your support of each other. It has just been wonderful. And, some new people are on the call asking questions. Amy, thank you so much for your very detailed response to them. That's so helpful. Wondering how they can be part of it. We've got some of our existing colleagues who we've known, we're friends, supporting each other. It's so wonderful. And then we've got Rhoda, who is one of those nurses that we seek out, that we hope will take us and see the potential. As you said, Amy, they can see what you can be more than you can. And I think those are the very key ingredients of Nursing Now Challenge and what we stand for. And I really hope that continues. And I've got such a great feeling about this year ahead. We will carry on and we will achieve great things together. There have been a few other questions in the chat. I don't know, Amy, you're seeing to that question there. Thank you so much. If anyone else has, I'm mindful of the time, and I don't want to keep you, but if anyone else has any questions, there is a generic Nursing Now Challenge email that you can email us on. And I think Hannah, that's right, she's just putting it there. If you would like to join, please fill in the form and start your journey. And from there, you will be part of the best family that you could ever imagine of nurses. We will care for you, we will cherish you, and we will support you. Please look out, be part of our organisation, and join us in this journey together. I guess we've got to be thankful to the nurses who have gone before us and the midwives who have gone before us who've made this possible. But you are making it possible for the next generation. So whilst you find everyone here inspiring today, you are inspiring. So that's what you've got to remember and hold on to. Thank you so much. And thank you, Hannah, so much for sorting this out for us and making us all good and sound and vision, etc. And to the wonderful, wonderful people who have joined us today, thank you so much. We hope to see you soon. If not, hopefully you'll take away some learning from today and thoughts, and it will have lifted your heart and made your heart sing. Happy Valentine's Day. Take care, everyone. See you soon. Bye.